Dr. Thomas Ho, a head and neck surgeon from Thomas Ho Surgery. Today I'll be sharing about radiofrequency ablation or RFA. RFA is a minimally invasive treatment we now use for selected benign thyroid nodules. It is a useful option that may benefit certain patients, and today I'll walk you through how it works and what to expect. RFA is a non-surgical treatment that uses heat to shrink benign thyroid nodules. Using ultrasound guidance, a thin probe is inserted precisely into the nodule and thermal energy is applied to ablate the tissue. There are no surgical incisions and the thyroid gland itself is preserved. One of the biggest benefits of RFA is that it's minimally invasive, which means the patient recovers very quickly after the procedure. It's done under local anesthesia and there's no surgical incision or visible scarring. The entire procedure is completed in under an hour and there's no need for hospital admission, making it a very desirable option for patients since there is no downtime. Because the therapy targets only the nodule while preserving the rest of the thyroid gland, a normal thyroid function is maintained and patients will not need long-term medication. It's a safe, effective, and practical treatment option for the right patient. RFA is suitable for patients with thyroid nodules that are confirmed to be benign on 2 biopsies and who are experiencing symptoms such as a visible lump, discomfort, or pressure when swallowing. It's also an excellent alternative for patients who are not fit for surgery or simply wish to avoid it.
I was diagnosed with a thyroid nodule, and although it was benign, it started to affect me both physically and emotionally. I did not want to go through major surgery or be dependent on lifelong medication, so I researched my options, and that is when I came across RFA and I read about Dr. Thomas Ho. During the consultation, he explained the procedure clearly, what I would experience and also how the recovery will be. And I think that is what gave me the trust and assurance that I needed to move forward with this procedure.
The procedure is performed under local anesthesia in an outpatient setting. The entire process takes about 30 to 60 minutes. A needle probe is carefully and precisely placed in the nodule under ultrasound guidance, and thermal energy is applied to treat it from the inside. Patients are monitored for a short period after the procedure and go home the same day.
On the day of the procedure, everything was handled so smoothly. The medical team was incredibly professional and made me feel calm and cared for throughout. I experienced some soreness, but discomfort was minimal. It was a very positive and reassuring experience from start to finish.
Patients are usually able to resume their normal activities the next day. The most common complaint is slight swelling and bruising, which usually resolves over a few days. Pain during the procedure is tolerable and often does not extend to the next day. Most patients start to notice improvement within a few weeks. Studies show that the nodule can shrink by up to 70 to 80% in 1 year. Patients often report reduced pressure, improved appearance without the sensation of a lump in their throat.
My recovery was quick and straightforward. I had minimal discomfort and was able to return to my usual routine very soon after, in fact the next day. My thyroid nodule has also shrunk significantly around 2 months after, and it was quite noticeable by family and friends as well. I no longer needed to be on long-term medication. Before discovering RFA, I was advised to surgically remove my entire thyroid gland. The thought of losing the whole gland and relying on lifelong medication was overwhelming. So choosing RFA with Dr. Thomas Ho was the best decision I made. It was safe, non-invasive, and I still have my thyroid intact. I'm glad I made the decision to go ahead with this procedure.
If you have a benign thyroid nodule and are looking for a less invasive solution, RFA may be a suitable option. It's a safe and effective therapy that allows you to avoid surgery altogether. You may visit us at Thomas Ho Surgery to see if this treatment is right for you. Thank you.